Hey guys, Dr. Jeremy Trunk at Balance Within Integrative Physical Therapy. Today I want to show you a couple key jaw releases which can help in a number of different areas. So even though I'm saying it's a release for the jaw, oftentimes there are other symptoms that can be associated with jaw dysfunction that maybe don't even appear in the jaw, but it can present as popping or clicking in the jaw, but sometimes it can be ringing in the ear, it could be stuffiness in the sinuses, and it can also just be headaches. So for the jaw, the muscles that will run from here will attach to the cranial region, so that's why the symptoms can kind of be across the board in some of the different areas with it. But I'm going to show you a release for some of the biggest key muscles of that region. The names are the medial pterygoid, lateral pterygoid, and the masseter. So I don't have to expect you to remember those names. However, though, I'm going to call it out though as to the areas I'm going to be working on, which one is by which name. So the first one is called the medial pterygoid, but what that's going to be is going to be in the back of the mouth, and right where the teeth hinge, right in the back of the mouth, there's a pocket of tissue on the inside of the teeth, which may be a little kind of ropey with it. And so I'm going to throw on this glove here. So if you're doing this on your own, you can use a glove, or make sure you wash your hands. What you're going to do, most likely, you're probably going to be using your pinky because it's just going to be the least invasiveness to it. And I actually do recommend that you do this at a table because it's going to be a little bit easier to have your elbow supported to get in there. Especially because too, if you have a really tight piece of tissue in your body, we do recommend that you hold things for a minimum of 2 to 5 minutes at a very lower level of aggression. If you do need a quick release, 30 seconds can be helpful. However, though, the longer the hold, the deeper the release to the tissue. Okay, so the setup for greater ease will be to your benefit. So working in the back of the mouth, use the pinky, and then where the teeth hinge, the piece of tissue back there. It's hard for me to talk with my finger on that spot there. But once it's on there, hold it in place. Did you catch that? Hold it in place. Okay. Second one's going to be lateral pterygoid, which is the twin to the medial pterygoid. With that one, it's going to be a little bit easier to get to, but it's going to be in the upper pocket of the back, or the back gum line of the upper teeth. So up into here, I'm going to slip into the back here. And then it's going to sink into a pocket of tissue that's going to feel a little tender. It actually also might feel kind of like a knot or a rope, but it's going to have a little tenderness to it. And same thing, 2 to 5 minute minimum. Okay, and then also that third and final muscle we're going to look at today is the masseter, which is your main chewing muscle. So with this one, we're going to be using a pinch technique. So index finger and thumb will probably work best for this. You're going to be pinching the cheek from the one finger on the inside, one on the outside, and you're going to be more so in the back of the mouth with this one, or the back of the cheek. Okay, and if you're unsure if you're on the muscle, if you bite your teeth down, I don't know if you can see that, but it will pop out that muscle of the masseter with that. So as you do it, same technique for the other ones, 2 to 5 minutes minimum for deeper holds and releases, and then also 30 seconds for shorter term releases. But work on those. Listen to your therapist for any specific instruction that may be more exact for what your body may need for it. But beyond that though, please look at our website and you can check out our newsletter for other helpful tips. And until next time, be well.